Hey everybody, thanks for joining in. We're going to give folks a couple more minutes to log on. They're all coming on right now, so appreciate everybody being on time today. Um, Short weeks are wonderful because they meant a long weekend. They are tough because we're all trying to cram 5 days worth of work into 4 days. So appreciate everybody being here. Like everybody's pouring in. Okay, great. We'll start in about, we'll give everybody maybe 2 or 3 more minutes. Um, Feel free to, I know it is still unseasonably cold and disgusting where I am. This weather has been very interesting. Feel free to share where you're where you're sitting right now, and hopefully your weather's better than ours is. Go ahead and put it in the chat, and we'll be monitoring the chat the whole time. Oh, Phoenix, it's got to be warm in Phoenix. I want that problem. Oh, we love our friends at Temper General. It's definitely warm down there. I heard the love bugs are out. I heard in Florida. All right. St. Louis. Nice. Right. Folks are starting to come on in. It's 92. I can't even fathom 92 right now. I would like to see 92. All right. Folks are starting to come in. We'll give it maybe another minute or so and get us going. See, Des Moines is, yeah, close to what we're having here.
Darian, you're winning. It's a high going to
Yeah,
be
you
today.
are. Yeah. That's about what it is here. It was like 50 something walking the dog today. All right.
I think we might get up to 70. It's going to be exciting.
Yeah, it's time already. It's come on. It's
You're definitely winning.
theoretically summer. It's time. All right, let's get started and folks will be coming as I know. Thanks everybody from being here. Oh, I love our friends at Henry Ford. Thanks everybody for being with us today. You may know that HP is doing its data summit in Indianapolis June 10th to the 12th. So we thought this might be a timely topic leading into that conference. And I know Josh and myself and Jerian will all be at the conference. So if you're going to be at the AI Summit, I think it's you can still sign up for the AHP Summit. Come find us and we can continue the conversation. A couple of housekeeping things. If you have questions, please use the Q&A feature. We're going to be monitoring that the whole time, and we'll get to your questions. And then there's definitely a Q&A period at the end. And you'll also be receiving an email with the recording within the next 2 business days. Okay. First, some introductions. My name is Jan Weinberg Wood. I'm the Senior Managing Vice President in the Campaign and Fundraising Strategy Division at CFS. I'm a former Chief Development Officer for a mid-sized health system in Maryland, and I've been doing healthcare fundraising for 30 plus years. Josh?
Thank you, Jan. So I'm Josh Laborde. I'm also a Senior Managing Vice President, though unlike Jan, I am in our Technology and Operations Division. I have been with BWF and Consulting for around 4 years. Just prior to joining BWF, I was the Director of Philanthropy Operations at Sutter Health in California. And then prior to getting into nonprofit fundraising, starting in higher ed, I had a few former lives in technology and telecommunications and startups. So very excited to be talking with you today about leveraging your data for healthcare philanthropy. Sharon?
Hey, everybody. I'm Charing Koshi. I've been at Kindsight for a couple of years now. And prior to that, I spent 25 years in frontline fundraising at a number of different organizations in healthcare and higher ed and in workforce development and in the performing arts. So excited to talk with you all today.
Hey. So, quick agenda. We're going to work through all of these challenges, opportunities, and what your existing data can tell you. And how do we get through as budgets become more challenging? How do we leverage all this to raise more with less? So let's get right into it. I think we all know this current climate is interesting, right? And look, we've been through COVID, we've been through the late 80s crash and lots of things. But the funding rollbacks are real right now, right? Many of us are hearing from our CEOs that our next fiscal year budgets need to be static or maybe even reduced. I've heard as much as 15% reductions being asked for at some places. So how do we, and yet our numbers, our goal numbers are still going up. So how do we do more with less? Staffing continues to be a challenge. Finding the right people who really fit your culture, who have the training, who can do what you need them to do. It's, you know, this is a people business. We raise money on relationships, so staffing is critical. The stock market volatility. We're hearing from a lot of donors who are saying, I'm going to give and I'm going to pledge and I'm going to do something significant, but I'm in a little bit of a wait and see, or I'll do this much now, but I'm not ready to commit the whole amount right now because of what's happening in the stock market. So that's an external factor. Donor competition. We've got some very acute things, whether it's the LA fires, whether it's racial and religious injustice, all sorts of things that are keeping donor attention. They still love us, they want to give to us, but it's also distracting them with some of their giving dollars. And how do we become the and in their philanthropy strategy? Rising costs, right? We all know, whether it's in the grocery store and the services that we buy as fundraising leaders, the costs of to do the work that we do are going up. And so again, how do we manage that and use our resources more effectively? And it is a polarizing political climate right now. No matter where you fall in that spectrum, that is a thing that is occupying discussions. And how do we manage that, especially when healthcare organizations are apolitical by nature, and how do we navigate that with our donors? Some of the key challenges, we just talked about the economic pressures. They're very real, and they're both internal and external. These competing funding needs. Again, for many of us, it's not that it's taking our donors away, but it might be distracting our donors or limiting what they're willing to commit to right now, especially if we're in campaign. Are they willing to pledge out the way they might have normally as they deal with some of these things? I had a donor the other day who was a Yale graduate say, I'm giving money to Harvard. He said, I never thought I'd live long enough to do that. So these are things that are really real and out there. Budget cuts and freezes. We're hearing it more and more, and yet our numbers that we're expected to raise aren't being changed. And so how do we use those resources internally? How do we think more creatively about the work that we're doing? Funding priorities. That's always a moving target in our organizations, right? And I think more and more of us are looking towards comprehensive approaches to how we raise money, to include capital, to include programs, to include workforce development. So, how do we manage all those funding priorities? There's so many needs within our healthcare organizations. How do we identify really what's going to resonate the most with our donors? And we've got at-risk programs, right? Whether it's health equity issues, or whatever it might be, programs that completely depend on philanthropic funding. How do we manage those as we look at our strategies in the next year? And general uncertainty, right? Every day you look at the headlines and the tariffs are in. No, the tariffs are being halted. Things are moving forward. No, they're not. So dealing in a time of uncertainty, and I think in healthcare we deal in uncertainty all the time, but it might be more exaggerated now than ever before. So that's why I think making strategic decisions that are really factually based as opposed to gut or instinctual, anecdotal beliefs, those are important as well. But if we can fortify them with data and real information, that's going to make a huge difference. Tyrion, you want to add to that?
Jan, that's exactly right. And I think when everything is uncertain and unpredictable, our tendency is to be instinctual and make gut decisions. Especially during COVID, what we saw was a lot of organizations sort of default to, we're going to pull back, we're not going to do anything, because that risk feeling was overwhelming, especially to leadership. They didn't want to make the wrong decision. And I know that a lot of us saw that play out. But organizations that double down on intentional data-informed strategies are the ones that emerge stronger. So as you look at these two slides, and particularly this one, I want you to think about, there are dozens of you on the call today. So your organizations are going to be very different, but they're sort of boiled down into either replacement of what funding from government grants or other places need to fill. And so you might be going to donors saying we need to cover what has been lost, or it might be augmenting what could be done. So it might be building a new building or going into different research areas. And Josh Burkholz, CEO of BWF, was the chair of Giving Institute. We're about to have the Giving USA data. The thing that I keep coming back to for years now is that even in times of economic crisis, giving never goes to zero. So in a couple of weeks, when we see the Giving USA data, you're going to note that billions and billions of dollars are going to nonprofit organizations. So the economic pressure that we're seeing doesn't reduce generosity, it just redirects it. So donors are just going to give differently. They're going to prioritize meaning differently. They're going to look at urgency and impact differently. So your messaging really just needs to make clear, and that opportunity just needs to not get lost in all the different things that are happening. And data is going to really clarify for your donors, what do they personally value the most, and how do you align your appeals accordingly? And at the same time, the donor base is shifting, right? So the demographics are shifting, what they care about is shifting. We'll dig deeper into that, but the only way to really scale that is with a really solid data infrastructure. So ultimately, efficiency is the new growth strategy to address all of these things. When all of these things are unpredictable and all of these things are changing at the same time, with constrained teams and tighter margins and all of these variables, operational efficiency is actually not about cutting, it's about reallocating. And the opportunity is in freeing up more human time from administrative work to spend more meaningful time with donor conversations, to unpack where does that alignment exist in spending and aligning the real that real opportunity with what you have to offer with what they really care about.
Great. Thanks, Tyrion. So what are those opportunities? And that's what Tyrion was just talking about. It is reframing our messaging, right? It is looking at where we are absolutely essential to our communities and to our regions. And how do we reframe that? The way we reframed our message in COVID, which was very important. Now's the time to do the same thing. Now more than ever, we need to connect with donors, and not necessarily with an ask, but with a conversation. How are you feeling in today's market? What are you seeing? What are you experiencing as a donor? How donors love to be advisors, to be valued advisors, not just supporters. Ask them for their guidance on what they're seeing as a donor, and what we can do best to connect with them. This operational efficiency is really key. When we're asked to freeze our budgets or even maybe reduce our budgets, it's that reallocation. It's using data and good solid information to figure out how we can do more with less. We can do it. We've done it in healthcare for years. So it's just using the data to figure out how do we do it at this point in time. Really elevating the importance of strong, grateful patient work. Whether you have a formal program that is truly intentional and strategic, or what many folks have, which is sort of an opportunistic grateful patient program that exists, and that we reach out to grateful patients, but it may not have the structure that it might ideally have. Now more than ever, those connections and using data, especially in a grateful patient program, to help drive those names, to help drive your portfolios, super important. And then don't shy away from campaign planning. Campaigns are needed. Donors want to see a vision. Donors want to see your mission come to life. They want to see that impact. So just because there's uncertainty, just because there's competition for dollars, doesn't mean we pull away from either existing campaigns or planning for that upcoming campaign. That is what drives giving and also what then gets you to that next level of sustained exponential growth. Josh?
So how can we use data to basically take advantage of those opportunities and address some of those challenges that we've discussed today? What I'm going to do in this first part of the webinar series is touch on or highlight 5 different tools or techniques that we can use to leverage the data to tell the story, to connect, and what Jan and Sharon have been describing so far. Some of you may be using some of these tools or techniques already. If you're a BWF client, it's possible you're actually using and deploying all of them, which would be fantastic if you are. I'm going to guess most of you joined us today because there are opportunities for you to expand your operational programs and deploy some of these tools and techniques to accomplish some of the things we've already described. The most common one that probably exists today is the business intelligence dashboards. However, I still see clients who very much heavily still rely on paginated, static, tabulated reports instead of using dynamic, drill down capable dashboards. There are a lot of benefits to using dashboards. We've thrown a few bullets up on the slide right now, and it looks like I'm getting some feedback that my audio is gargled, so I'll try and pronounce a little bit better. My throat has been giving me some trouble this morning, but with business intelligence dashboards, the key takeaway is that you can automate a lot of your reporting. You can gather a lot of the data and information in a very optimally digestible format, right? So at the end of the day, you have the information at your fingertips and you're able to spend more time taking some of the other activities that were mentioned in terms with, pivoting due to the current environment and developing and implementing a new strategy and or, connecting with donors. Something that has been very common in the marketing space for a very long time, and we've seen it start to grow in the philanthropy space and in the healthcare philanthropy space specifically. For those of you who aren't familiar with persona analysis, just think about, for-profit marketing and how they try and understand their different consumer groups. You can think about, and I mean no offense when I say this, the term soccer mom that came out of a marketing persona effort to try and identify a group of folks who had shared traits and shared attributes and potentially shared values, right? And by doing this type of analysis and looking at your data to do clustering and doing other data science type of techniques to group folks, you may know one person very, very well and another person not so well, but you can identify that they fall into the same group and have the same persona. So what you know works very well with the person you know very well, there's a very high probability that that will work well with the person you don't know very well because they have those shared traits and those shared attributes. And having that knowledge can really help you inform your strategy, both long-term as well as short-term as you're navigating some of those challenges we talked about today. Forecasting and simulations is something we've been doing here at BWF for a long, long time. We've done it as a part of our campaign planning. We've done it in different times of uncertainty. It was a very useful tool for a lot of our clients during COVID. We even have seen some of this be deployed in some way, shape, or form back in 2008 when there was the economic turn down there and the economic challenges. But this is something that can be extremely valuable as you're looking at projecting out the next few years, as you're looking at what are the most likely outcomes, statistically speaking, right? Taking into different factors. Of course, looking at historically what has proven out, but also looking at some of the economic indicators that exist out there in the market. So you can literally forecast a specific outcome. What is your, fundraising production going to look like next year? And have a range of possibilities that, statistically speaking, is going to give you the most likely result that's going to fall within that range. But you can also do simulations, right? What does it look like if we do decrease our staff? What does it look like if we increase them? What does it look like if we do reallocate efforts, into a different program? If we shift things, if we do less solicitations and less ask, but do more cultivation and more stewardship activities. You can run those business scenarios and simulations to have that information. This is something that I don't think a lot of organizations tap into for a variety of different reasons, right? If they don't have the data scientists on staff, if they don't have a partner that they can leverage to help provide some of these services, that's challenging, but it's such a useful tool. And as we talk a little bit later around ROI and this current climate with the economic uncertainty, this is one of the tools and techniques that I believe will actually provide some of the highest ROI and really position organizations to come out of the other end of these times, positioned best for continued success.
Josh, I'd like to add to that. As we all go into budget season, right, when we're told either we have to cut people or we see an opportunity to add people. Alice Ayers did a great study, and I think Johns Hopkins did it with her, and it showed that $1 of invested in philanthropy yields the same net income for a healthcare organization, a hospital or a health system, as $75 to $100 invested in any kind of clinical or operational program. So as you are getting your budgets ready and making your case at the budget table, using your data to show we've got 200 prospects who are great prospects that we can't get to because we don't have enough frontline fundraisers. If we add one MGO, this is the return we're going to see. Or if you're asking us to cut people, this is what's at risk if we cut somebody. So this is a key part. Use your database really intelligently and intentionally as you move into your budget seasons.
Thank you, Jen. Another technique that I want to highlight, and this one is, I believe, much more common at organizations these days. Most organizations are doing some form of connection analysis and or capacity analysis. I believe anyone who's doing any kind of campaign planning is looking at the capacity of their database and trying to assess, how much money can we potentially raise over the next year, over the next 3 years, over the next 5 years for these particular initiatives or priorities or for these other ones, right? And then from a connection standpoint, I don't know, I think it was about 10, 12, maybe 15 years ago, where we really started to see an uptick in people looking at engagement scores and connection scores and affinity scores to look at mining the data to evaluate, who is most connected to our mission and our organization. And if they are very connected, are they assigned to a portfolio, right? Do they have wealth, which, Sharon, of course, Kindsight with their iWave capabilities can help suss out, right? Do they have wealth and capacity to give, and are they connected? And if so, why don't we have them assigned? Right? Or do we even realize that they're there and we don't have them assigned? These are things that can be done. We produce a strike zone report that looks at connection along with well screening data and tries to identify those folks so that you can do a better analysis around portfolio optimization and your deeper dive into your prospect identification. So this is another key tool and technique that I wanted to highlight today, because while I feel it is more prevalent out there, I still know a lot of organizations aren't fully deploying this. And this is something that you can deploy at relatively low cost. I did a learning lab at an AHP International, I don't know how many years ago, and it highlighted just how you could very quickly build a very simple binary, yes or no algorithm, if you will, with just 20 questions to help gauge the affinity of your constituents for your organization, right? So if it's just a matter of needing a little guidance on how to get started, or if it's a matter of not having the bandwidth, we can help, other organizations can help you, navigate this. But this is a very significant tool that if you're not tapping into, I highly recommend you explore. And it has such a low cost. The ROI is just through the roof on this one. Tool that I wanted to spend time diving a little bit deeper into today is our Donor AI predictive modeling tool. Other organizations also have predictive modeling offerings out there. Predictive modeling, and again, BWF has been doing predictive modeling for a decade and a half at least. We have shifted some of the techniques and evolved them to take advantage of some of the more readily available tools like AI that have existed today. We did actually beat the generative AI boom to market by launching Donor AI before ChatGPT was launched. But what AI has allowed us to do is take the predictive modeling that we've been doing for a long time. And if you're not familiar with it, we can build predictive models that can predict the likelihood of each individual donor making a major gift in a certain time frame, or likelihood of a group of donors renewing their gift. Or, I mean, it's endless in terms of what we can engineer to be able to predict. So whatever those questions are that you may have, that it would be extremely helpful for you to be able to know the likelihood of and have some predictions around, we can do. And now, with the power of the AI tools that are more readily available, we can scale those predictions. So we have a data science team, and we have previously been constrained by their bandwidth, how many hours in the day they have to engineer these predictive models, to do feature engineering, to look at the most impactful and influential factors that exist within the data. Now we still always leverage a data scientist to do the engineering, but we leverage AI to scale it. So maybe when we're doing best fit modeling, instead of building 15 models and looking at which one's the best predictor, we can leverage AI to build hundreds of models and tell us which one's going to be the best predictor. So this is something that I also know there's a lot of apprehension and concern and uneasy and just, a lot of things that are unknown around deploying AI. I think in the predictive modeling space, it is much more proven, and a lot of those unknowns can be answered much more easily. I am actually facilitating a panel at the HPAI Summit on the ethics of AI. And when you look at it in the lens of predictive modeling, it's a lot more clear than it is in some of the other aspects where AI can be deployed in philanthropy. So this is one that I felt very strongly about including, and that I thought, if you're not familiar with, I know we've pushed out a lot of information around it as it's evolved over the last few years. Like I said, I know there are other organizations out there who are doing predictive modeling to some extent, and they've pushed out information, but this is definitely something that if you're not doing today, you should explore. Those were the 5 that I wanted to touch on. So kind of to wrap them up and bring it together, there are other tools and techniques that we'll explore in part 2, and we'll kind of bring some other things together. But really, I think what I want you to take away is that there are tools and techniques out there currently, some of which are more accessible than others from a budget standpoint, but all of which have a very high ROI. Now, we'll talk a little bit more about that, but I also want you to know the data in and of itself is not the only aspect to be able to achieve, better outcomes. One of the other keys is strategy, right? You have to know what you're looking to accomplish before you can figure out which tool or technique is going to help you best accomplish that, right? You have to know what your strategy is. Now, you can iteratively have an idea of what you think your strategy should be, deploy some of the tools and techniques to then help inform and hone that strategy. But you have to have the strategy be a partner with the tools and techniques. And you have to have your staff and your resources, right? If you deploy some of these tools and techniques, and I've seen this at organizations, both at organizations when I was acting, when I was internal as a practitioner, as well as organizations I've supported as a consultant. If you deploy these tools and techniques, you don't have the staff available to make use of them and implement them and act upon them, that's going to be a challenge and a hurdle. So you can't just look at the tools and techniques and the data in isolation. You have to incorporate your strategy, and you have to look at your staff and what their capabilities are. And then you bring back the tools to help tie everything together with the data. We do have a QR code up here for an assessment, a free assessment that's available on our website that can help you assess these kind of 4 different dimensions and look at things in this way. All right, I might have gone over my time a little bit, but hopefully not.
Good.
So, Jen?
Good. So let's get back to where we started, which is we need to demonstrate our need for campaigns, for funding priorities, right? This is what we do. This is how we drive giving. And by using our data more productively, more intentionally, with our teams internally, with outside help when we need it and when it's appropriate, that's how we're going to drive funding. I will tell you, you have a wealth of strategy information sitting right in your database, and the issue is how do you best analyze it and deploy it to make really good decisions, especially in tumultuous times. Again, when we have to cut budget, in our heads, we have to look at, let's not cut, let's reallocate. So how do we use data to increase the efficiency of what we do? Where can we, a lot of times organizations are looking at FTEs. How do we use our FTEs most productively and therefore use our data most productively so that we have more time in front of and engaging our donors? The business intelligence dashboards are so important, and once they're set up, you and your own team can run them yourselves, right? So having those dashboards at your fingertips, it's really critical. It gives you on a daily, weekly basis, looking at performance, looking at conversion rates for your donor asks, looking at how many asks are you getting out there? How many donors do you have in cultivation right now? How is your conversion ratio growing or decreasing? What's working as you look at your donor engagement strategies, and therefore how can you pivot to make those strategies more productive? So having those really, the days of Excel spreadsheets are gone, and really having business intelligence dashboards that you as department leaders and/or foundation leaders can make good, strategic, intelligent decisions on a regular weekly basis is really critical. Plan giving, that's the one that sometimes becomes the stepchild that we forget, and yet it's so important to invest our resources in that. When you're a CDO, and I can never forget, you get that sudden call from an executor that says you've got a $3 million gift coming that you weren't planning for but it's those seeds that were sown a year ago, 5 years ago, 20 years ago. So how do you use data to better identify who those planned giving prospects are, especially in healthcare, where we've got clinicians who have been with our organizations for 20, 30, 40 years and are probably interested in leaving a legacy in the place where they've built their careers. How do we use our data on our donors to really identify those great planned giving prospects and develop a more intentional strategy around them? Cherian, you want to add to that?
Yeah, and also with tying into that last bullet point around grateful patient pieces as well, measuring that engagement life cycle of patients from point of care to their first gift. There's a really interesting study from Dr. Katie Milkman that talks about generosity decay. So the longer you wait between when that point of care happens to when that ask happens, the less likely you are to have a gift. But mapping out that engagement life cycle and knowing what that cultivation and stewardship plan looks like for folks really makes a difference. And so as you think about that for plan giving as well, all of these pieces interconnect. So thinking about your data less as a what happened and more thinking about it as the collective memory of your organization starts to shift your perspective on how you are operating with the information that you have, and knowing that every piece of the puzzle can be at your fingertips and can be used to help fill in the gaps of how was that grateful patient connected to these care providers, these doctors, and how were they, what parts of the giving history, what was the context in which they were connected? What was it, a campaign? Was it a crisis? Was it some sort of other event that they were connected to? All of that actually becomes relevant to how that story comes together. So, as Jan mentioned, it's not like it's funny to say like the days of Excel spreadsheets are gone, because we all sort of resonate with that. But we all also remember that that was all that we had. And it was very linear in how we thought about a donor journey, that it was a very column focused approach to this happened, then this happened. But that's not actually how people interact with our hospital systems, with their care, with their foundations. So when I was fundraising, it actually caused me a lot of grief to get that call that we were the recipient of a multi-million-dollar bequest, because it actually meant that we didn't steward that donor. We didn't interact with them in the way that we should have. We missed a lot of opportunities because we were surprised in that moment, and they took it upon themselves to have the initiative to make the bequest and find out what programs needed the help and all of that stuff. And I felt really bad that we didn't get to do the relationship building. And, that may be their choice. That may be what they want to do. But when it comes to the effort that we could put in, like if they do want that touch point, I think we owe it to our mission and to those donors that do want that interaction to have. And some people don't want to talk to us, and that's fine. Like, I get that. But for the folks that do, we owe it to them to have that relationship and that touch point to say, this is how you can help, and to be able to put that story together for them.
Thanks, Turian. And so, as I said, using all of this data to drive our budgets to optimize our efficiency is really key. Josh?
Yeah, so and we're actually coming up pretty close on time, and I know we want to have a good bit of time for questions. So I'm not going to spend a lot of time on this slide, but I do want to point out, right, that if you can more heavily leverage your data, then you can do more with less, essentially. That is, I guess, the overall takeaway, right? So I'll just kind of leave it there as we move into questions. And then I did see a question come in the Q&A. So I'm gonna give it a first swing, and then I'll turn it over. But because this was a question that came to me a lot as a practitioner when I was managing development operations, philanthropy operations, where frontline fundraisers would say, yeah, everything that you're suggesting is great, but I have way too many people in my portfolio and each one's an individual. And what you're telling me doesn't necessarily apply. When we talk about leveraging data, we're not talking about replacing your interactions with the individuals or anything along those lines. We're talking about using data to get you 80 or 90% there. and allowing you to really focus on that last 10%. So we talked about persona analysis.
Hmm.
If you're looking at your donors in your portfolio as 100 unique individuals, it's really hard to figure out where to start with each. If you can group them into 3 or 4 or 5 different personas, then you got a starting point with each group, right? And if you're dealing with 100 different folks in your portfolio, and you can use predictive modeling and donor AI to help you identify which ones are the most likely to give in the next 3 to 6 months, then you can help prioritize efforts around the ones who are most likely to give sooner or who are most likely to take a call, right? Because I believe in the question in the chat, it talked about how difficult it is to get a donor to meet with you or take a call. So things like donor AI can help predict who's most likely now. And that's another thing that AI has helped us do when we scale our predictive modeling. It used to take 3 or 4 months to run a predictive modeling, and it was the results as of a point in time. And then maybe we would run it again next year. Now with AI, we can run it in a week, and we can run it every month. And we could even potentially do it more quickly than that, though I don't know that our data changes often enough, and or I don't know that we are flexible enough to react to the changes and to do it more frequently. So as we talk about ROI, doing it too frequently just it doesn't increase the ROI much. So that would be my answer to the question, but I'll turn it over to others as
And
well.
and I'll add to that as a, former chief development officer leading teams. I agree that what the data isn't, what it's going to do is allow you to prioritize your portfolio and to reshuffle your portfolio in a more timely manner, right? We all have the donors who you're this close, you're this close, so you don't want to move them out of your portfolio. The AI and other data can help you realize they're not as close as you think they are. It might be best to put them over here for right now and then re-engage them in 6 months, or they are that close, and therefore here are the things, as Josh was saying, the things that are going to push them towards that next step. So I think it is about allowing us knowledge to understand how our donors think and react and when they think and react, and therefore manage our work more effectively and efficiently so that we can then invest in the meaningful conversations that are going to be successful right now, and keep those other conversations out there and monitor them as those donors continue to evolve and as their relationship with us continues to evolve. So it's really about managing your work and your relationships in the most time efficient and relationship impactful way that yields you to the best and most successful and sustained relationships, right? Because that's what this is all about.
I don't have much more to add. I mean, so the last mile piece with the donor is dependent upon a whole lot of other factors that come into play. So one piece of this, if you think about all of the 5 pieces that Josh talked about, they all work together to kind of create this kaleidoscope of different lenses. So when you use all of them, they create decision velocity. So one piece gives you a bit of a clue, but when you put them all together, they actually make decisions. They give you permission to move. And so you do get closer to decisions, but one of the pieces, in addition to persona, is you get insight into channel preference. You may find out like this person doesn't want to be called. And there are people like elder millennials and even millennials who actually don't like to be called on the phone. So there's a piece of that might, and a person's a person. So don't, like, I'm overgeneralizing on generations there, but there might be people who, like, if you sent them a text message or an email, that might be prior to a call or prior to a meeting, that might be a thing. But in addition to just like that major gift conversation, think about how like capacity and affinity ratings might drive a lift in, if you know someone has a higher capacity, that initial gift ask string could change, that leadership annual gift piece might change. You could do a lot of things early on to understand what their interest is and what then drives the context of their giving, such that upstream you have a better context for then what could mean their larger gifts later on. So just throwing that out there as well.
I don't see any other questions. Please know if we switch to the next slide, you'll see sort of, I think we're going to do a
Well,
poll
Jen,
next.
before we go, because I think we do have a few more minutes, I've gotten a question recently around the differences between forecasting and simulation and predictive modeling. So if that's confusing, I can spend a second talking about forecasting is basically looking at the likelihood or a range of outcomes for a specific result, right? So I can forecast how much money we're going to raise next year. And it's going to give me a range, right? Simulations are, how is that forecast going to change based on different scenarios? Adding staff, decreasing staff, shifting focuses and what like that. Predictive modeling is much more focused around predicting the likelihood of an event. So there is some overlap. There is some Venn diagram between those. But when you're talking about predictive modeling, it's one thing to say, I want to try and predict how likely this person is to make a major gift versus trying to forecast how much money we're going to raise next year. So I don't know if that's helpful to the audience, but that's a question that's come up a lot around the differences between forecasting, simulation, and predictive modeling.
Josh, couldn't people also use that to simulate, like, if a major donor, like a really significant major donor, doesn't give next year, and what would the implication of that be?
Yeah, if you can take a look at the data, and you're going to have a certain number of transformational gifts at the highest level, right? And you can do forecasting simulations and predictions around. Like, first, let's forecast what is it going to look like? Do we think, how many of these do we forecast we think we're going to get?
Mm-hmm.
Right? Then we can do simulations around, if we change certain factors, how does that affect the forecast? Right? And then we can literally drill down into the donors who have made those gifts over the last 5 or 10 years, and then predict the likelihood that they'll make another one. And then we can even expand out, if we've done some persona analysis, to look at other people who fall into the same persona as the people who have made those gifts. And we can try and predict how likely are they to make a gift at that same level. So, I mean, it really is tremendous, the power that these tools have for us.
And the virtue of that is, like, the machines can do that so much faster than a human can, with so many different, like, iterations, right?
Yeah.
Like, it would take dummy old me 2 days to even start thinking about that, but the machine can do that in 2 minutes.
Yep. All right. I think we do have time for one more question, if there's one more out there. All right. If not, we can move along. Jen?
Yeah, so we've got, I think the poll, one of the things we always want to know is, what do you want to learn about? As I said, Cherian and Josh and I will all be at the AHP Summit in Indy, June 10 through 12, and love to hear your thoughts more on all of this, but also like to hear other things that are interesting to you where we can help provide some information. So if you'll do a 30-second poll, hit up there and do as many as you'd like. And are there other things that you'd like to hear about related to healthcare philanthropy that we haven't touched on? Obviously, the giving data report will come out in the next couple months, and we'll be doing something on that for sure, because that's always important information for all of us. So if you can take a moment and do the poll, we'd appreciate that. It helps us understand what we can do to better keep you all informed. And as we said, I got this question, I saw this in the chat. Yes, we will be sending out the recording of this that includes all of the slides. And I'm happy to, if you go to the next slide, I think it is, we have our email addresses. Oh, no, sorry, let's talk about the second part of this webinar, which happens on June 18th.
Yeah, absolutely. So we have a part 2 of this in your, there's a QR code there for you to register for that as well, where we'll talk about kind of optimizing your portfolio using some of what we talked about today, but then also looking at how to use AI for prospect development and engagement. So again, kind of upstream, what are some opportunities for identifying some new donors, and then how to engage those donors, and then some of the new and other kind of adapted approaches to drive success in engaging those donors as well. So we encourage you to register for that. We'll talk about some additional opportunities in what is within your database and outside of your database as well. So look forward to seeing many of you there, and feel free to bring other teammates as well.
Great. And then these are our emails. Please don't hesitate to reach out to us with questions, with your thoughts. We'd love to hear what you're doing in your shops and what's working well and what are points of frustration. And it's really helpful for us to learn what's happening out there and really see what we can do to help you or connect you with other folks who have similar experiences and help you in your journey. We hope you see you at the AHP Summit. It should be great. And we look forward to seeing you guys at the next webinar. All right. Good.
Thanks
Thank you,
all.
All
everyone.
right. Thanks, everybody. Take care.